Hello, this is Dr. K, and today I want to talk to you about your parasympathetic nervous system and polyvagal theory. And I want to show you from more of a clinical standpoint what you can do to actually affect your vagus nerve and actually upregulate or make your parasympathetic nervous system work more effectively and function at a better capacity. The reason the polyvagal theory is important is the idea that you have three aspects of the vagal system. Now, the vagus nerve comes out of the brain, comes out of the foramen like a hole inside of the skull near the medulla. It exits to the medulla oblongata, and it will come down and innervate your chest and your lungs and your heart and your diaphragm and your enteric nervous system, your digestive system. It is your primary parasympathetic nervous system and nerve function to your whole and entire body. And therefore, it's very important, it's very necessary to have it functioning appropriately. If you've had traumatic stress or PTSD or a trauma in a war setting, or you've had a loss of a loved one or some trauma to your body, these things can get stored in the body as emotions, as neuropeptides, and big trauma can ensue, and it feels very unsafe. The world around us feels safe, relationships feel safe, and you'll wonder, why does this situation keep playing out? Why do I keep going in a traumatic state? Well, certainly work with your doctor, work with your practitioner locally, but I wanted to show you this because I think this is something you could add to anything that you're learning about polyvagal. And I'll show you some exercises to do that are very powerful that I just simply don't see other doctors or practitioners sharing. A lot of them I've been doing over the years practicing functional neurology with the tens of thousands of patients I saw. And I started to realize, like, if we, what I call, it's called a parasympathetic stack or neurostacking. You stack these things where you have multiple things that are affecting the sacral nerve roots, the cervical nerve roots, because the cervical nerve roots and the sacral nerve roots are parasympathetic function, right? Your thoracic spine, your lumbar spine, in between the two are your sympathetic tone. So we don't really want to focus here so much there. We want to focus with the cervical spine. We want to focus on the sacral spine. And we want to focus on upregulating and stimulating the vagal nerve response. Now, before I get into that, because this is really effective. I mean, if you have a stressed out teen, or your wife or your partner is upset or stressed, or you are in your own life, which is always best to start with ourselves first before we start trying to tell other people what to do to be fixed, quote unquote, is we want to also be aware that as we do this, we can tap along what's called the temporal sphenoidal line, and it goes right along the base of the at the top of the zygomatic arch, right, your cheekbone. Just right above there, you tap here using your fingers like this kind of point, tap, tap, tap all the way around, and you can't get this wrong. It doesn't matter which direction, it doesn't really matter. What we're doing is we're stimulating temporal sphenoidal line for the purpose of stimulating these Chinese meridians along here. You can also stimulate along the eyes, neuro-emotional technique or emotional freedom technique, even better yet. You could look at the points. That's not what this video is about, but these are points where you can stimulate along these areas where I'm tapping, below the eyes, below the nose, below the lips, and on either side of the sternum. So medial parts of the eyebrow, lateral parts below the eye, below the nose, right in the center, below the lips, right on either side of the sternum, right? So while you're doing this, or after you do this process I'm going to show you, tap these in, stimulate these points. Chinese medicine, Chinese meridians have been around, or the awareness of them have been around thousands of years before Christ historically was on the planet. It's like 4,000 years. So it's been around. It's, subjectively and objectively been tested and shown. And it's just, you can do these exercises without it, but it's always much better if you're activating your nervous system and stimulating, because it allows it to drive this information in deeper. I won't get into some of the other processes you can do. It's just way too complex, but let's get into polyvagal, because that's really huge. So there's three parts, right? There's the ventral vagal, there's the dorsal vagal, and there's the sympathetic nervous system. I'm not going to get too much into each one, but polyvagal, it's all about safety. It's all about, do you feel safe in your body? Separation from one another actually creates a sympathetic dominance. It actually creates a sympathetic state where your body actually is afraid. It doesn't feel like it's going to be okay. So the more you're not seen, the more you're not heard, the more you're not connected, the more your body goes into a sympathetic or stress dominant state, starts to produce a more acidic physiology. So you become acidic, right? You become more stressed. Your minerals aren't utilized as well. Your cortisol is released more from your adrenals, and that causes luteinizing and hormone surges. And so the whole body can be thrown off by the baseline resting state of your nervous system. Have you ever met somebody that's just stressed out of their mind, and even they have a chihuahua and the chihuahua's shaking and it's just, they're both stressed out? That's somebody who's in their sympathetic dominance. And you can say, hey, I can show you some things that would really help you and your little chihuahua out so you can be more relaxed and feel more at peace. And whether, it will help you feel more relaxed, you will feel more peace, you will feel more centered. But it'll also help your physiology and your body's neurology function at a much better state. So you're not, it's like driving your car and like the 5,000 RPMs, like really high, you're revving the engine, you're going to burn it up. And most Americans run like this. So this is a big deal. But being in this space of being in sympathetic dominance puts us into our reptilian brain, and we're kind of like more sharp. We shut one another down, we interrupt someone, we feel more likely to have more pain, and this actually cuts off oxygen and blood and nutrition to the body. So it's a really big deal. So things that will also really help with vagal stimulation, before I actually show you the exact stack that I use, and you can simplify it or make it more involved based on your personality type. But we must have community, we must have connection. So if you're not getting enough of it through the COVID situation, find family or someone you love or trust, or get a dog or a cat or love on them more, because it's very important. We also must have a very healthy digestive system, digestive tract. So we want to get that. We want to enjoy more fun, more dance, more play. And these are huge things that are really important if we're going to be also healing it in our life, not just doing some neurological exercises. Because this actually, the polyvagal theory, the coolest part about it is that you and your separation from one another and from community, actually, they've proven this neurologically, will make you sick. So it's important to understand and recognize that right now more than ever, to work with your vagus nervous system. I show it to patients and clients, or the retreats I do, to help people drop in a deeper meditative state, a more peaceful state, to break an anxiety attack, to help us just be in more connection and listening to our hearts and ourselves. And we're really spun out and really fearful. We're easy to move, control, manipulate, and tell what to buy. This is about you getting more in connection. So I like to take it beyond just standard neurology. This is something that can really help you in your life. So here's what you do. As you do these processes, you can't get this wrong, so don't be alarmed or worried. You tap along the temporal sphenoidal line. You maybe want to add an additional tap along those emotional freedom or EFT points. If you just Google that, it'll come up. Tap those at the end after doing a few of these. I usually do 5 to 10 at the same time. Here's what they look like, and I'm going to read them off here. One of them is starting off with diaphragmatic breathing, breathing into your diaphragm, breathing in for 4 seconds, and letting it fall out for 8 seconds. Breathing in for 4, letting it fall out for 8, or breathing in for 3, letting it fall out for 7. You just want the exhale longer than the inhale, because your exhale, if it's too short, then it stimulates your sympathetic tone, like a holotropic breath, like, will actually increase a trauma state for some patients and clients. So we just want to breathe in and double your exhale. So that's one of them. Another one, very powerful, and actually there's a whole technique around it. You don't need to do this, but you can use your fingers. You don't need to do the technique. I mean, the whole big, long, drawn-out thing that they have online. Take your fingers, you find your belly button, which is your umbilicus, right in your tummy right there when you were a kid. And you see, what's this? My belly button, there's a hole. You go right over there and you tap towards your spine. So you're just going in at the belly button, tapping towards the spine. You're stimulating the parasympathetic nervous system when you do that. You can also use a vibration device or one of these hypervolt devices online. It's just a vibration. You're just tapping very gently along your umbilicus, maybe along just below the ribs, while breathing a little bit is a good way to add it in there. You can also do a little bit of gentle taking your hand and gently tapping over your cervical spine, or even the back of your hand, the open hand over your cervical. tap over your sacrum, right, on your low, deep down, right between your pelvis bones. Tap on your sacrum there. You can actually curl your toes and your fingers at the same time. This is usually how I would do the stacking if you wanted to do it. You would curl your toes, you'd curl your fingers, you'd suck on your tongue for a little bit, push your tongue to your cheek, push it up a few times, push it down into the base of your jaw, or the floor of your mouth, I should say, if we want to be specific. So curl the toes, curl the fingers, suck on the tongue, move the tongue, tickle the roof of your mouth with your tongue, swallow, swallow again, doing all these at the same time. Also holding a Kegel. A Kegel is the muscles for the vaginal and anal area, so we want to just tense those muscles. So curl the fingers, curl the toes, hold a Kegel, suck on your tongue, tickle the roof of your mouth, right? Swallow a couple times. Then I want you to take a deep breath in, hold your breath in your chest, pressuring right here, and then with a sigh, relaxing all of those things. You relax all of those things at once. And what it does is it allows your whole body to just start to come into a more relaxed parasympathetic state. Again, tap once you're done with those three things or those things. Tap here if you want to, you know, it literally, this process, what I call a parasympathetic stack, neurostacking, it literally takes 5, 10 seconds, 15 seconds. If you add it to your meditation or a stressful drive to work, or if you add it to, you know, a hard, difficult conversation with a boss or a loved one or with your child, it will really help your nervous system. And if you're dealing with anxiety or depression or any kind of health system issue, this will improve it because it's just generally helping your nervous system function at a better, more parasympathetic rate. Last things I want to say and share is that just some additional things is having a cold bath, a cold shower, ice bath. If you're a Wim Hof fanatic, you can sing, right? Singing, humming, really or low or singing, you know, like really powerful for this. It's very powerful to get this going. Being in nature, right? Swimming or other things. Carotid stimulation, which is where you just touch over your carotid gland. Or even coffee enemas that directly affects your enteric nervous system because you're taking something into the lower colon and it's responding, right? So that's a lot of things. But I want to show you there's a tremendous amount of things and tremendous amount more. You can tap after you do these. That will really help if you incorporate them. So the simple neurostack I say to have patients do that I work with directly just to really affect is one more thing, is to start off with your eyes just to the right, and you hold it and you just breathe normally. Hold it for up to a minute. Just when you'll feel your nervous system relax. You may notice a yawn, a sigh. You may get a little bit of tearing. Your mouth may salivate. These are all signs that you're in parasympathetic. You know, you go to bed and you're just like, oh, boy, I'm getting ready to go to sleep and I'm going to crash out. That's your body being in parasympathetic tone. So it's really a vital thing to recognize that you need this. Otherwise, you stay up all night. And so people that can't sleep, you know. So the stack, just to give it to you one more time, because I also want to add the eye thing, is starting off with your eyes. You're looking straight ahead. You're just going to take your eyes and hold them there as far as you can, directly to your, your 3 and 9 o'clock positions. Hold it at your 3 o'clock position, hold, breathe. When you feel relaxed, then you do the other side. Breathe for a little bit, relax. If you feel your nervous system kind of calm down, feel a little bit of a shift, you can come back to normal. Curl your fingers, curl your toes, suck on your tongue for a second, hold a Kegel, tickle the roof of your mouth, around the sides, around the front. Should really tickle and be annoying. Swallow. Swallow again like a big swallow, right? But you take a deep breath in, holding all of those things still. We're stacking these together, right? Because we're stimulating the brain to hold this information in a better, more effective way. We take a breath in, holding all of those, hold pressure in your chest, and then take another swallow possibly. And relax. And let your body just relax for a minute. From there, depending on if you're a patient or a client, utilize some of the other things I'm showing you, or drop into your meditation, drop into your listening, drop into nature, drop into a wonderful conversation. It'll really help you be more in the present moment. It'll really help you be physiologically, neurologically, more in a centered, more peaceful, enjoyable state. And after all, that's essentially what we're here for. And if we're not, then we might as well play in a more peaceful, relaxed state. That's the way I see it, because why would we want to be stressed out our whole lives? So this is something that you can really utilize and try it on for yourself and notice. You'll feel it if you feel it. So I look forward to seeing you in the next video, and just try this one on this week.